Okay, so we are going to talk about pharmacology, and you have the entire book PowerPoint as well as this PowerPoint created and uploaded for you. I am going to talk about a lot of the introduction to pharmacology stuff, and then I am going to specifically talk about each medication and the drug card requirements and things like that. So this will probably be a couple of sections of this video. So pharmacology itself is the scientific study of medications, all right? So we need to understand how that works. So make sure that you are looking in that textbook PowerPoint as far as the terminology that goes along with that, pharmacokinetics, how things are actually working inside of the body. We're going to specifically talk about the medications themselves, the trade names, generic names, mechanism of action, indications, contraindications, side effects, routes of administration, and doses that go along with those, as well as the 6 rights of medication administration. So those 6 rights are the right medication, right patient, right route, right dose, right time, and right documentation. So you want to make sure that this is in fact the correct medication, that is the right patient that you're intending to give it to, which seems pretty self-explanatory, but if you have multiple patients there, it could be confusing. That you're giving it the right way. Some of these medications, especially as you continue forward in your career and if you progress up to an advanced EMT or paramedic, there are multiple different ways that medications can be given. So you want to make sure you're giving it the right way that's best for this patient. That you're giving the right amount, especially when we start talking about pediatric patients and why those weight-based drug dosages are so important. You're going to talk about the right time. Is this the right time in between doses if you're giving multiple doses, or the right time after they've already taken something over the counter? So right time for medication, and then the right documentation, making sure that everything, how you administered it, what you administered, how much, what time was it given, the patient's response to it, all of that is documented in your narrative. So the trade name of medication is the brand or the commercial name, and so that's usually what we call things like Advil or Tylenol. Those are actual brand names or trade names of medications, and that's different from the generic name. The generic name is the name that anybody can use, and that's a non-commercial name that has been assigned to this. Now, medications also have a chemical name, which is several parts, very long name, but the generic name can be used by anybody. That's actually the name of the medication. The mechanism of action is the biochemical interaction that causes a pharmacological effect. So what's happening inside of the body when you take this medication? So a medication that constricts blood vessels that would cause an increase in blood pressure would be called a vasoconstrictor. That's its mechanism of action. That's what it does inside of the body. Now, indications, contraindications, and side effects. Indications are the reasons that you would give a medication. So, for example, you have a headache, you would take Tylenol. An indication for Tylenol is a headache. A contraindication means a reason that you would not take or give a medication. And there are 2 types of those, a relative and an absolute contraindication. The relative contraindication means that if the benefit of giving it or taking it outweighs the risk, then you could still administer it. An absolute contraindication means that under no circumstance should you give the medication, and it absolutely should be avoided. So we'll talk about some differences between those relative and absolute contraindications with the specific medications. Side effects, these are the changes in the body that could range from minimal to severe. Some of them, in comparison to other things, are not that bad, like nitroglycerin. A side effect of that is a headache, but when you consider that it's relieving your chest pain, the headache is a small price to pay, most would say. So again, the side effects are usually minimal in comparison to what could be going on, but sometimes they are potentially harmful or dangerous to the patient, and so we want to make sure that we are aware of every potential side effect that could happen. Talking about some routes of medication administration, you have the PO or oral route, where medications are actually swallowed and absorbed through the digestive tract. Now, anything that is absorbed through the digestive tract is called an enteral medication. So if it is given by mouth, if this is something that was given like through a feeding tube directly into the GI tract, rectally, those are all enteral medications, and everything else would be considered parenteral, entering in through peripheral sites. Sublingual medication means that it's being administered underneath the tongue, and so usually that's dissolved under the tongue without chewing or swallowing. The buccal route, these are when medications are administered between the cheek and gum and absorbed by the mucous membrane. Now, the medication that we use at the EMT level that's given buccally is oral glucose. This is an oral glucose tablet, and usually we carry the gel, but I wanted you to physically see the tablet dissolving in that area and how that's much different than swallowing it because it needs to be absorbed directly into those mucous membranes. That's much faster. Taking something by mouth or PO is the slowest form of medication administration because it has to be absorbed by the digestive system before it takes effect. Inhaled medication administration, that could be a nebulizer, which is what you see in the first picture, or the middle one, which is a metered dose inhaler, or MDI. Both of those are inhaled medications. Intranasal medications, you see here she's taking a nasal spray, and these medications are administered directly into the mucous membranes of the nose. So that's with some type of device that's meant to be sprayed into the nose, like an Afrin, or you can use a MAD, which is a mucosal atomization device. And that's what this is here. So a MAD, and usually most people will say MAD device, but it's mucosal atomization device that is going to be allowing medication to go from a liquid into a mist. Okay, so that MAD device can attach to a Lurlock syringe, so it's twists right on, and you can administer medication intranasally just like this. So we use the MAD device for naloxone or Narcan. Now, when you create that mist, you've got to push fast enough for it to create a mist, but not so fast that you lose control of the amount of medication being administered. You need to have a good idea and a good grasp on that. When you are administering, it's important to remember that if the medication amount is more than 1 ml, you should administer half the dose into each nostril. So if you're going to give less than 1 ml, you're fine to just give it in one side, but if it is 1 ml or more, you want to split that between both nostrils. Ideally, you would close the other nostril to prevent it just from running out, but if the patient is lying supine, that's less of a concern, and you don't really have to do that, and that's what you see here in this picture. But that's a really good example of how the MAD is used. Now, injectable medications, there are two ways that you might inject something, and that is intramuscular or subcutaneous. And so intramuscular goes into the muscle just like it sounds like, and subcutaneous goes into the subcutaneous site above the muscle into that fatty tissue. So the IM needle is held at a 90-degree angle perpendicular to the skin, and the skin is pulled tight to, or taut to expose as much muscle as possible. Whereas what you see here on the right-hand side is a subcutaneous injection. So they're holding that needle at a 45-degree angle, and they are pinching the skin up to get as much subcutaneous tissue there as possible. On the left, they're actually using an auto-injector for an IM injection, and so they're not pulling the skin tight here, but they are holding it at a 90-degree angle. And we'll talk about the difference between those when we start talking about the medications for them. Now, looking at some dosages here, adult dose versus pediatric dose. The adult dose typically offers a range, so you can give between this amount and this amount, and it's a provider discretion based on the situation and the size of the patient as to how much you would give. With the pediatric dose, these are typically going to be weight-based, and usually that's written in milligrams or grams per kilogram. And so you have to actually do the math on that and figure out what goes with what. So we'll do a few examples of those in another part of this video to give you some practice with pediatric drug calculations. Now, this is going to bring us to the medications themselves. So what I'm going to do is start talking about each medication, and then I'm going to do a separate video that is giving you some more information about the drug cards. What I will tell you up front is that everything in this PowerPoint is essentially going to be on a drug card. I have done all of the work for you. I have found all of the information for you. You do not have to go out and find anything else. You're going to use the information that I give you in these PowerPoints PowerPoints to create your drug cards. All right, so I literally cannot make it any easier for you if I tried. So please do not take advantage of that and do what you are supposed to do. Make your drug cards so that you have them to study by. At the end of the day, the drug cards are not for my benefit, they are for yours. I know these medications. I know what the indications and contraindications and dosages are. By creating your drug cards and having those smaller versions available for you to study by, you are going to be helping yourself in being able to study more efficiently and have all that information in one place. All right, so don't sell yourself short and actually spend some time, some good time working on those drug cards and creating a good resource for yourself. So I'm going to stop this video here and we'll pick up in part 2 where I'll actually start getting into the medications.